Welcome back to the Dr. Rich channel. Today we're answering questions from viewers. Vegan woman asks, is sex tightened after a sacro surgery? Stick around to the end to find out. Hi, I'm Dr. Rich, and my passion is to provide every woman with practical knowledge about the world of women's health. Today, we're answering viewer question, vegan woman, who asks, does sex tighten after sacro surgery? Well, let's rewind. Let's talk about the sacrocolpopexy. So this is a prolapse repair surgery. It is the gold standard. It has this high success rate for prolapse. Prolapse is when the vaginal skin becomes loose, the connective tissue fails, and the vagina itself and the organs behind that, the bladder, rectum, small bowel, actually push the vagina outside of the body where a woman can feel that. They'll describe it as they feel something down there when they're showering, cleaning, they're sitting on an egg, sitting on a bulge, something like that. So this symptom, this problem, which is very common, 33% of women will have prolapse during their lifetime, 18% of women will have prolapse surgery, can be repaired by the surgery sacrocolpopexy. Now this word is made up of three parts: sacrum, which is the sacral ligament, colpus or colpo, which is vagina, and pexy just means tie together, okay? So the abdominal mesh is placed during a robotic surgery. It is attached to the top of the vagina, the other end attached to the ligament, which functionally reduces or removes or gets rid of that bulge because it restores the normal anatomy. It elevates the vagina back internally instead of being able to be palpated or felt outside the body. For more details around this surgery, please check out our last video here. So this question brings up the concept of elective cosmetic vaginal surgery. Now, this idea, this concept is a poorly defined collection of a number of different surgical procedures that essentially are only done for the cosmetic benefit, including labial reduction, augmentation of the labia majora, clitoral hood reduction, G-spot stimulation or amplification, hymenal ring reconstruction or hymenoplasty, and in general the term vaginoplasty, which can be done surgically or with the use of laser. Now, in some cases, these surgeries can be done for clinical indications such as pelvic pain, sexual pain, prolapse incontinence, prior injury, reversal of female genital mutilation, and a number of other indications. In the majority of cases, these cosmetic surgeries are done purely for non-clinical indications, non-medical indications, for the express purpose of altering the physical appearance. And the procedures are often marketed to also enhance sexual function. However, the data for all of this is very lacking. There are complications that can occur from these cosmetic surgeries, including worsening of appearance, pain, scarring, bleeding, and all of these risks need to be taken into consideration if you're considering having cosmetic surgery. The other factor that really should be taken into account is there is a wide range of different appearances that are all considered normal for external genitalia, which you can also reference in the description section below. But for one example, the opening of the vagina can be anywhere from 1 to 7 centimeters, and this is all just considered the range of normal.
So contrary to what OnlyFans tries to make you believe.
So it's funny you mentioned that. So surgeries such as labiaplasty have doubled in the last 10 years, and the literature has shown it's because patients have access to a very strict sense of what is considered normal on social media and access to readily available access to pornography. And when you're only shown one particular way that things should appear, you don't consider the fact that a normal part of aging, a normal part of birth, is that there is a wide range of normal anatomy, and you're looking at 1%.
We seem to be inside
I'm old!
I beg your pardon?
A patient would want to seek out a surgeon that has some proficiency and training and expertise in this particular specialty. So why this sudden increased interest in cosmetic vaginal surgery? Well, a recent survey showed that women between 18 and 69, 79% of them had waxed or shaved all or most of their pubic hair. And so now that there's better visualization of the anatomy, it's easier to detect discrepancies, what someone might consider imperfections, and there's a lot more attention on that now. So what's my take on all this? Well, certainly, anybody's entitled to their natural sense of how their appearance is, whether that's their nose, their breasts, any part of their body. And they're entitled to feel better about things and to seek out cosmetic surgery. At the same time, though, it is incumbent upon us to provide accurate information. There is natural change in anatomy around birth, around menopause, and these things don't represent disease processes in of themselves that need correction. But again, if someone chooses to have that, that's certainly something that I would support. So do it because you want to, not because the world's making you feel insecure about it. So what does any of this have to do with sacrocolpopexy? This is a clinically indicated, medically indicated surgical repair. Whereas a byproduct of that repair is likely to provide a narrowing of the vaginal opening and in that sense more of a tightening. This is never the primary goal of that repair. The primary goal is to restore normal functional anatomy. And in most cases, cosmetic procedures for the purposes of tightening are not clinically indicated, not covered by insurance for that matter, and those are things that certainly can be done, can be offered, but usually is not the prime focus of a pelvic reconstructive surgery. So really the answer to the question is you need to speak with your gynecologist or your urogynecologist or your pelvic reconstructive surgeon about what the goals for the repair are so that this can be coordinated with what the anatomy is, what the end result is going to be, and how that matches up with authorization with your insurance. Did that answer the question?
Perfectly not confusing.
So at the end of the day, it's a topic that you need to discuss with your provider to make sure they understand what your goals are and they can reconcile that with the planned repair. Hopefully this helps, and we'll see you at the next video.